This is a cartilage tutorial presented by the SchrDbb with reference Atlas of Histology with Function and Clinical Correlation by Dongmei Cui. So here we are going to continue with cartilage. So the cartilage, we start with the introduction of cartilage. So in the introduction of cartilage, you just know that all the cartilages have extracellular matrix. 1. Cartilage are usually covered by a membrane called a perichyndrium. 2. Cartilage have cells called chondroblasts. 3. Cartilages are avascular, just like connected, just like epithelial tissue that does not contain blood vessels. 4. And then the fifth element is that the cartilage have different types of growth. So we have appositional growth and we have interstitial growth. So the next thing are the cells of the cartilage. So now the cells of the cartilage, there are three main types of cells in the cartilage. There are two main types of cells in the cartilage. The first thing is that we have chondrogenic cells, which are located in the perichyndrium. So we have three types of cells in the cartilage. So we have chondrogenic cells located in the perichyndrium. That's the membrane that overlies the cartilage. The second thing is that we have chondroblast cells. The chondroblast cells are the young, or also called the young chondrocytes. They are immature chondrocytes. They are just located inferior to the perichyndrium and inside the cartilage. And then the last one is the chondrocytes, and the chondrocytes now are the mature cells, and they are located now far inside the lacunae. They are lying inside the lacunae in isogenic groups. Now, cartilage matrix. The matrix of the cartilage can be made up of collagen fiber, and the main collagen fiber is type 2 collagen fiber. And now you remember down that you can just scroll up and go back to the next video, which was the video on connective tissue. You see that we have the type 2 collagen fibers was produced by chondrocytes and chondroblasts. So this is why this type of collagen is found mostly inside these cartilages. Also, it may also contain type 1 collagen, and it may also contain elastic fiber, depending on the type of cartilage that we are speaking about. Now, the ground substance inside the cartilage is mostly including glycosaminoglycans, and then is mostly consisting of glycosaminoglycans and proteoglycans, glycoproteins. So that's the ground substance, and this ground substance can be called, depending, so mostly some people use, better to use the term of chondroitin sulfate. These glycosaminoglycans and proteoglycans found as cartilage, as the matrix inside the cartilage, are going to be called chondroitin sulfate. Now, the types of cartilage. The types of cartilage, you have three main types of cartilage. You have hyaline cartilage, you have elastic cartilage, and you have fibrocartilage. Hyaline cartilage is made up of the perichyndrium, except the hyaline cartilage is found at articular surfaces. Elastic cartilage is made up of elastic fibers in position. So, but you need to know that hyaline cartilage is mostly made up of type 2 collagen fibers. Elastic cartilage is made up of elastic fiber mostly, and then it also has a perichyndrium. The one that does not have a perichyndrium is going to be called fibrocartilage. It does not have a perichyndrium. So we are going to see elastic cartilage is located at the level of the ear. The hyaline cartilage is located at the level of the respiratory tract. That's the nose. Is located in the respiratory tract. That's the trachea, the larynx, the bronchi. That's the hyaline cartilage, and also located at the articular surfaces. Located at the articular surfaces of the long bones. Now, fibrocartilage is mostly located at the intervertebral disc, and it's also located at the level of the pubic symphysis, and those are the places where you have the fibrocartilage. And the hyaline cartilage also have the level of the costal aspect of the stem. Now, the cartilage growth, needs to know that the cartilage growth is going to be divided into two. We have an appositional growth and we have an interstitial growth. So all that we're going to explain that later. So now we start with the types of cartilage. The types of cartilage, we have hyaline cartilage, which has this diagrammatic representation. Hyaline cartilage, which is diagrammatic representation. As you can see here, we have isogenic groups here. Isogenic groups of chondrocyte located in a particular lacunae. Is it clear? And the uppermost part is made up of the perichondrium. For elastic cartilage, you also have isogenic groups of elastic cartilage located in a particular lacunae, and uppermost part we have the perichondrium. While the fibrocartilage cells are much more at the isogenic groups of the cells here are circular in a pair of 2 or 3. While the isogenic group in the fibrocartilage are much more in a parallel direction in a pair of 2 or 3 also. Is it clear? And they are parallelly located with, since fibrocartilage they are much more located in the pressure containing area like disc inside the intervertebral disc, or dislocated inside joints, you are going to see that they have to have elastic fibers, and they should have also collagen fiber, and the collagen fiber are in the same orientation, just like the orientation of the isogenic groups, in order to maintain a higher strength. So this is a specific characteristic of each of them. Hyaline cartilage characteristics that it contain type 2 collagen. Elastic cartilage contain type 2 collagen and elastic fiber, while fibrocartilage contain type 1 and type 2 collagen. Now, chondrocyte arrangement. The chondrocyte arrangement is mostly in a group called isogenic groups. Here, elastic fiber chondrocyte arrangement is in groups called isogenous group, and then fibrocartilage, the chondrocyte arrangement are mostly in small and sparsely arranged in parallel columns or rows. So sparsely arranged in columns or rows. As you can see here, they are in columns, but they can also be present in rows. Now the perichondrium. Yes, there is a perichondrium in hyaline cartilage, except at the articular cartilage surface. Elastic cartilage, yes, there is a perichondrium. Fibrocartilage, no, there isn't. So okay, now the main location of hyaline cartilage is the trachea, the bronchi, the ventral end of the ribs, the cartilages. We have the nose, the articular ends, the epiphyseal plates of the long bones, all that are hyaline cartilage. Also, all the cartilage inside that make up the skeleton of the fetus is also hyaline cartilage. The next one is the elastic cartilage. Is located at the level of the epiglottis because it's elastic. It's located at the level of the larynx. Elastic cartilage is located at the level of the pinna of the ear. Located at the auditory canal of the ear and the tubes. Now, fibrocartilage is located at the level of the articular disc, the intervertebral disc, located at the pubic symphysis and insertion of tendons. Now, the main function of hyaline cartilage is going to confer shape flexibility, form the cartilage model of bone and ground substance. Is going to produce a surface that provides free movement of joints. Yet it only confers shape and elasticity for elastic cartilage, and for fibrocartilage is going to provide resistance for compression, cushioning, and tensile strength. Now let's see hyaline cartilage. So hyaline cartilage, this is a schematic representation. Outside here we have the fibrous layer of the perichondrium. The inner part here is made up of the inner cellular layer of the perichondrium. This is the outside layer of the perichondrium. This is the inner cell layer of the perichondrium. The outside layer of the perichondrium is made up of blood vessels. You need to know that we said that cartilages are not having blood vessels inside, so they are avascular. Is it clear? So the outside aspect of the perichondrium is having, outer layer of the perichondrium is having the blood vessel for nutrition of inside. So all the elements that flow into here is by transport, by passive transport movement or active transport movement. Now this is so we have here at the level of perichondrium you have chondrogenic cells, and then later down we have the chondroblast, and then inside now we have the chondrocytes, which are located in isogenic groups. So that's so we have the territorial matrix. The territorial matrix is the matrix inside a particular isogenic groups, and we have interterritorial matrix. The interterritorial matrix is located between two isogenic groups. And then we have collagen fibers. The collagen fiber in hyaline cartilage is mostly collagen type 2. and then the isogenic group is a group of 3 or 2 or even 4 cells, as you can see here. The next thing is, this is the hyaline cartilage of a bronchus. So you can see here isogenous groups. You have the territorial matrix inside the isogenous group. You have interterritorial matrix outside connecting two isogenous groups. These are chondrocytes here inside the lacunae. Now here we have chondroblast, which is directly underneath the perichondrium, and then here we have the perichondrium with the chondrogenic cells inside. The next thing, we have the hyaline cartilage of the bronchus. So we have increased just the diameter in order for you to see the terminal, the territorial matrix, to see the interterritorial matrix, and to see the chondrocytes. The next thing to visualize here is going to be hyaline cartilage of the trachea. So the hyaline cartilage of the trachea, you need to know that what you still have the perichondrium above, and after the perichondrium, inside the perichondrium, the chondrocytes, here underneath you have the chondroblast, and then you have underneath again you have now the isogenous group made up of chondrocytes. So the up here is chondrogenic cells, then chondroblast, then the isogenous group containing chondrocytes. Here, this is the hyaline cartilage of finger bone. So hyaline cartilage of the finger bone, articular surface of the finger bone. Here you see that what there is no in hyaline cartilage of the finger bone, there is no at the articular surface, alright, there is no perichondrium. Is it clear? So you can see here at the apical, at the uppermost layer, you see this is the joint surface here. So you have small flattened chondrocytes. So since there are small flattened chondrocytes without any perichondrium. So you have the chondrocyte here, and then you have the lacuna of the chondrocyte here. So you have no perichondrium at the articular surface, you can see. Now, osteoarthritis. What is osteoarthritis? It's a chronic condition characterized, so it is a degenerative disease of the articular surfaces, full stop. That's the definition of osteoarthritis. Degenerative disease of articular surface usually occur in the weight-bearing areas, may also occur at the level of the fingers, the hands, the level of the hands, the hips, the spine, mostly the weight-bearing areas. That's osteoarthritis. Now, what is the histologic view of osteoarthritis? You have fibrillation of the articular cartilage. Normally, articular cartilage, as you can see here, it is flat, it is smooth, as you can see here. The articular cartilage. But if you have fibrillation, it only becomes rough like that with some fibers. That's called fibrillation of the articular cartilage. Just know that this is one sign of osteoarthritis on histologic view. Now, if you have ebunation, and what is ebu? So if you have ebunation, and ebunation is as a result of subsiding, staining, and the loss of the articular cartilage. So you come here, you don't see any articular cartilage, you directly see the bone. Are you seeing? So you see, so when there is loss of the articular cartilage, is going to be called ebunation. This is the articular cartilage that is found here, but there is fibrillation. If there is now ebunation, that means that there is loss of articular cartilage. You need to know that what articular cartilage is going to be slightly pink. It's not too pink. It's pale pink, while the bone which is underneath is much more pink. So if you see that it is not pale pink, it's much more pink like here, just know that there is ebunation. Ebunation means that there is loss of the articular cartilage that was present above. And then the last one is subchondral bone. You see subchondral bone in a very pink layer. So if you have pale purple, you think of fibrillation, and with fibers here, you think of fibrillation of articular cartilage. Articular cartilage is still present, but with fibers. If there is this purple, then it's ebunation. It means that there is loss of the articular cartilage. But if it becomes pinkish, it is subchondral. It means that there you can see already the subchondral bone. And when you see subchondral bone, it means that there is complete loss of the articular cartilage. So you can already see here, this is by one particular lacuna which contains one chondrocyte, and in that lacuna there are isogenous groups, there are lying groups, and that group you have territorial matrix and you have the interterritorial matrix. So this is a particular isogenous group. These are the nuclei of the chondrocyte and all that. The next thing to visualize now is the representation of the elastic cartilage. For the representation of the elastic cartilage, above here still you see have the perichondrium, you have the chondroblast. Here we have the chondrocyte inside the lacuna. You have the elastic fibers, both the elastic fibers and the type 2 collagens are present inside the cartilages. You have isogenous group just like in hyaline cartilage. So this is an example of the histology section of the epiglottis which shows elastic cartilage. So in this histology section what are you going to visualize? You see pinkish cells, so this is pinkish layer. You have elastic fibers which cannot actually very seen on a hematoxylin and a usine stain. So you are going to see chondrocyte. Chondrocyte can be seen here. Here up here is a perichondrium. You can visualize the perichondrium up here. You can see the elastic fibers here. So we have isogenous groups here. You have different isogenous groups and having the different chondrocyte cells. See in the perichondrium, you have the chondrogenic cells, you have chondroblast, and inside your chondrocyte. But the peculiarity is that here in elastic cartilage, you are going to also have elastic fibers. And in order to easily reveal the elastic fibers, you need to use the elastic fiber stain. The elastic fiber stain is going to stain the elastic fiber dark, so you are going to see much elastic fiber, as you can see here, dark, because the elastic fiber stain is going to pick up the elastic fiber are going to pick up the elastic fiber stain in order to become darkish, and then you can see the chondrocyte as well there. Then the next one is the representation of the fibroblast. For the representation of the fibroblast, you have no perichondrium. As you can see, you have the type 2 and the type 1 collagen. Type 1 collagen, because the fibroblast is very tough and resistant size strength, and located at the intervertebral disc. So you can see the chondrocytes are having a particular group, but they are arranged in columns or in rows. As you can see, here is an example of the fibrocartilage of the intervertebral disc. Here you can see these are the chondrocytes located in the row, and these are the cartilage, type 1 cartilages here. So the chondrocyte you can see. Now, the clinical correlation is disc degeneration and herniation. So herniation of the intervertebral disc is common cause of pain. So what is just herniation? Herniation is a protrusion, it's defined as a protrusion of the nucleus pulposus. Usually you need to know that the disc, intervertebral disc, is divided into two: annulus fibrosus and nucleus pulposus. Annulus fibrosus is made up of fibrocartilage, and the nucleus pulposus is made up of a jelly-like matrix. So the nucleus pulposus now is a mucous connective tissue, jelly-like matrix with mucous connective tissue. As you have seen in connective tissue, mucous connective tissue contains jelly-like mucin. So it's a mucous connective tissue. So when it protrudes, that nucleus pulposus is going to protrude the annulus fibrosus, and then it's going to pinch the different nerves or even the spinal cord. That's going to be called disc herniation. So this herniation may be due to a disc degeneration, that is the degeneration of the annulus fibrosus. So when you have degeneration of annulus fibrosus, which occur because maybe due to age or maybe due to any other injury, so it may cause that disc herniation as a protrusion of the nucleus pulposus to the annulus fibrosus. So this is just a diagram of how it represents. So the nucleus pulposus is going to protrude through the annulus fibrosus. So on that histologic section, this is not actually a histology section, just a diagrammatic representation of how this degeneration occurs. But on histologic view of the disc herniation, so if you just do the histologic view, though it's not easy, it's a clinical diagnosis or an imaging diagnosis, not a histologic diagnosis. So in order to do it, you can visualize with, so when you do a histologic view of that disc, you are going to see that it's going to be degenerated, that you are going to have the loss of the type 2 collagen, you have loss of type 1 collagen, and you are going to have more chondrocytes which are going to lie free inside the matrix, and an increased matrix also. So now this is the cartilaginous growth. So how does the cartilage grow? We have said already that the cartilage can grow either by appositional growth or by interstitial growth. Appositional growth is an increase in length, while interstitial growth is an increase in thickness. So appositional growth occurs when you have the increase in number of the chondroblasts. So when you have increase in number of the chondroblasts, it's going to push the perichondrium in order to increase in length. Is it clear? So when you have an increase in number of the chondroblasts, is going to push the perichondrium, which are located at the periphery, in order to increase in length. Is it clear? Why the interstitial growth? For interstitial growth is only increase in number of the chondrocytes, which are located in isogenous group. So it's which are located in isogenous groups. So it's going to push the cartilage outward in order to increase in thickness. So those are the two main types of growth that we have. So after having the growth, so we say that we are finished now with cartilages, and then we can pass into bones. Thanks for your kind attention.